Good morning, everybody. Thank you, Bruce, for this wonderful introduction. I'd like to start by thanking the organizers for allowing us to speak here. And mostly, I'd like to thank all of the folks in the audience that decided to show up to this workshop. We're going to talk about a few things here. First, I want to go over some definitions. There's always confusion about what the raw materials versus starting materials are, and I'm going to go over that in a little bit of detail. Then Bruce has already mentioned it, but I'm going to go one more time on the complexity of today's peptides. Then we'll have some notes on quality assurance as well as regulatory challenges. And then I'll have a summary of all of this as well as an example that will illustrate what we're discussing today. Now, the topic of raw materials is very vast, but I'm only going to touch up on just a small portion of it. So what is the difference between raw materials and starting materials? Starting materials are part of raw materials. If you look at the slide here, you'll see that this includes reagents, it includes starting materials, of course, reagents, resins, container closures, as well as anything that touches the product. So spatulas, filters. And starting materials are part of the peptide sequence. So that gets a little bit tricky because sometimes you wonder if it is part of it or it's not. But most of the time, it's an amino acid or a linker of some sort. It could be a diacid, a fatty acid, and so on and so forth. But let's take an example of acetic acid. Acetic acid is used to cap peptides, and you form an acetylated peptide. At that point, acetic acid becomes part of the starting material list. So the next question that comes is, do we follow the GMPs or we don't follow the GMPs? As far as the ICH is concerned, this is the table that comes from ICH Q7, and production of the starting material where the arrow is up above, when it comes to chemical manufacturing, the production of the starting material doesn't need to be made under the GMPs, but introduction of the starting material has to be under the GMPs. Now, how about intermediates? Intermediates, in our experience at Polypeptide, if it is 2 to 3 amino acids, it could still be a starting material and not an intermediate, but at right around 3, the regulatory authorities will start questioning whether you're utilizing the GMPs to produce the intermediate. So for dipeptides, it's not a problem. For a tripeptide as an intermediate, it's not, you're going to have to follow the GMPs as a conservative approach. Bruce covered the majority of this, but I'm going to go through it one more time. So peptides have changed over the years from simple linear peptides to different modalities where peptides are coupled to antibodies, they're coupled to oligonucleotides, small molecules, and so on and so forth. And the market demand for higher quantities is here. We have the obesity and as well as the type 2D market that actually is utilizing quite a bit of the capacity for peptide manufacturing that is currently available. That being said, the availability of starting material is at a higher demand, and that's where one of the challenges is, which I'm going to get into. That's not the only thing when it comes to peptides these days. There is a trend that we have seen recently by the US regulatory authorities that Peptides have to follow small molecule specifications, so the specification of unspecified impurities of only 0.1% and so on and so forth. That's part of ICH Q3C, if you're interested to look at it in more detail. So that's another challenge. If the specifications are for the API, or for the API is changing, then the specification for the raw materials are going to change as well. So let's go over quality and regulatory notes and challenges. So the quality of the starting material will be the basis of the quality of the API. And the expectations from the authorities are changing constantly. So this requires continuous evaluation, specification, analytical methods, the process of manufacturing the impurity profile. And the route of synthesis is one of those items that actually is not easy to obtain from the vendors. We'll talk about that some more. So those were general terms. When it comes to quality assurance, however, as far as starting materials are concerned, how does that work with the product life cycle? So you could get starting materials from any place you'd like to for preclinical as well as toxicology lots. But when it comes to phase 1 and 2, which is where the GMPs start, you need a qualified vendor and you need qualification of the raw material. So we will talk in detail about what we mean by the qualified vendor and qualification of the raw materials shortly. But once you go to phase 3, it's the same as phase 1 and 2, but then you have more vendors. And if we go to PPQ batches and then commercial operation, then you even have larger quantities, so that's an issue of negotiation with vendors or multiple vendors, and the delivery time, so you could maintain continuity in your production. So what do we mean by qualification of the vendors? So you need to have either a questionnaire, an audit of the vendor in person, or you need to make sure that they could sustain an inspection. We, as manufacturers of peptides, host audits all the time because they want to make sure that we will sustain an inspection. It's the same thing for raw material suppliers. And again, for non-clinical batches, this is not required, but for clinical batches, it is required. So either questionnaire, audit, but you want to make sure that they could sustain an inspection by the regulatory authorities. Now, what do we mean by qualification of the starting materials? That's a bit of a tricky question, and I want to go over it in a little bit of detail. So it starts off with specifications. Then you need to get the route of synthesis from the vendor. When you get the route of synthesis, you will deduce then what type of impurities could exist in this raw material and what the impact is on the API itself. Then there is the issue of potency. So what do we mean by potency? That means that you have to generate a method that does purity as well as potency, but in this case, potency is the content of the starting material versus residual solvents. For example, if there is acetic acid, you want to minimize the acetic acid content in your starting materials. If there's other solvents that the starting material came with, like hexane or something else, then in order for you have to be able to quantify this so you'll use it accurately in your production. We talked about quality notes. Let's talk about regulatory notes. They include specifications, analytical methods, and the actual manufacturer's challenge, the challenges that we see with manufacturers. So as far as specifications are concerned, we have to have complete specifications in the regulatory file. That means identity, assay, and the whole list that I've outlined, including how much acetic acid there is, because acetic acid has tendency to cap if you use it during the coupling cycle. And that's important to note. But mostly, the specifications are set based on what the API specifications are. So if it is for a generic API, which has a less than 0.1% for unspecified impurities as a specification, then the spec for the raw materials or starting materials have to be tight as well. In the case of NCEs, where there's a little bit more leeway, the spec could be less than 0.5 for unspecified impurities. But I'll go into detail a little bit when I present an example as to what I mean by all of this. And we talked about specifications. Now we talk about analytical methods. They have to be state-of-the-art. They have to be described in the regulatory file, and they have to be validated. So these are the three things that are very important for the state-of-the-art methods. That's because of tighter acceptable specifications. The method has to be described in the file, and then the validation is another note. But let me focus a little bit on validation. I lost my train of thought for a minute there. In order for you to validate, you have to have impurity standards, which are not always easy to find when it comes to starting materials. Impurity standards are, we will go through the details. For most of the amino acids, we have worked out that problem. But when it comes to new linkers and new and other starting materials that are more contemporary, those are not always easy, because if we don't know the route of synthesis, then we don't know the impurities that will be there, then we don't know which ones we should be sourcing, and so on and so forth. I don't know why it doesn't work all the time, but okay. Anyways. Oh, let's talk about the manufacturer's challenges. And it basically revolves around flow of information, because regulatory requires the information, we can't get the information in time, or we can't get the information when we request it. Let's start at the beginning, the synthesis process, the route of synthesis. Some of these starting materials, there's some know-how on how to make them, and at a metric ton level, there's an even bigger know-how. And the vendor will not always be willing to share that. With that comes the challenge then of the justification why not to include it, and or to include it somehow. And guess on the route of synthesis is what we've done in the past. But any changes in the synthesis process, even if we got the route of synthesis, those have to be included in the file as well. Now, regulatory will try to avoid that, but the customers and the regulatory authorities will request that. And when we add new manufacturers, the information about the new manufacturer, we're always challenged with data to get the information in time. I want to give you an example here as to how critical it is. When we have several manufacturers, we have to outline in our batch records how many manufacturers are for each starting material. So that's how serious this is. Let's move on to quick overall summary, and then I'm going to go through an example that's going to illustrate things. So we talked about the challenges, and I'm going to summarize them very quickly here. Manufacturing challenges, it's not a challenge at small scale, but it's a challenge at larger scale. The specification is with relation to the API. If it is 0.1 for unspecified versus 0.5, then you got a different set of specifications. In our case, for the 20 amino acids that we use, or the 22 amino acids that we normally use in our production, we have gone through the 0.1% specification level just to be on the safe side. And the cost of and availability at large scale is also a challenge. That's a negotiation factor. We talked about the vendor qualification. I don't need to go over it one more time. We talked about the starting material qualification and the potency test to see how much content of the starting material is in the powder or in the liquid. And then I'm going to talk about a control strategy, which is basically a tight set of specifications as well as a contemporary methods to analyze our starting materials. And then there's some regulatory documentation challenges that we discussed, with the vendor information being on time. So let's go through an example here that probably will illustrate things further. At the expense of repeating myself, I'll go through the challenges for, let's say, protected amino acid as an example. So there's qualification of the vendor, availability at large scale, and the route of synthesis, establishment of the specifications, regulatory challenges, multiple vendors, and flow of information. We talked about that. Modern analytical techniques, which we will describe further next, and then adopting a control strategy, which we're also going to describe next. So here's an example of a UPLC method as a modern analytical technique to separate all the impurities from FMOC, aspartic acid, OTBU. That's the example that we're describing here. So the method has to have an LOQ limit of 0.03 to 0.05% in order for us to have a limit of 0.09 mole percent. And I'm going to come back to mole percent in a minute here as to why we have chosen that. But the impurities are measured as a relative response factor because not all of the impurities have the same response factor, obviously. And the method has to be mass spec compatible so we could identify them. And I can't read from this far, but you probably have a better chance of reading. It's just basically the example shows that we have separated all of the impurities from the main peak. By the same token, we have to have also a modernized Cairo HPLC method, which is also a UPLC method. Again, we're going for an LOQ of 0.03 to 0.05. But we have to make sure that the D enantiomer does not coalute with the main peak. And as you can see, it's fully separated. Everything else is not the D enantiomer, and it could be unspecified impurities, but as you can clearly see, the separation. And again, we're shooting for an LOQ of 0.03 to 0.05 because we want to have limits of less than 0.09 mole percent. I thought it would be interesting to tabulate all of the impurities on one slide here. So we have a list of these impurities. Most of them are less than 0.09 mole percent. Now, let's focus on the mole percent. Why do we need to make it as mole percent? That's because at that point, you're normalizing the absorbance, and you're normalizing also the quality of the API, meaning the load of the impurities on the API. Okay, so that's why we have chosen to go with mole percent on this. A TLC is outlined because we use it still, but it's being phased out. And then the residual acetic acid, that's quantified by tandem mass spec. So what is our control strategy? The first layer of the control strategy is the tighter specifications as well as the modernized analytical methods. This will help us discharge most of the impurities that could happen in peptides when it comes to, in this case, amino acids. But that's the first layer of control because the real layer of control is to make sure that we work well with the vendors to reduce impurities as much as practical. And that wraps up the presentation. I think I'm ahead of schedule a little bit, but I'm open for questions.